invoke the divine blessings for the successful completion of this afternoon's conference.
A conference of this magnitude on women's health. A conference convened for the benefit of local medical practitioners in the North was beautiful and satisfying. It is indeed my pleasure to... She is the Assistant Minister for Health and Medical Services and has been a household name. Her career began with the Communications of Fiji Limited in 1990s and was bestowed with several awards. The Assistant Minister for Health and Medical Services
the management of TICI Sangam and the School of Nursing, organizers and coordinators of the conference, staff of the Ministry of Health and Medical Services and Northern Health Services, distinguished and invited guests, ladies and gentlemen, Nisambula, Namaste, a very good afternoon to you all, Om Sai Ram. Before I proceed any further, I'd like us all to join hands and applaud Ben Ryan and our boys for winning gold medal. That has made all Fijians proud, and we are proud of our boys. Thank you so much. I know Australia is good, New Zealand is good, very good. Fiji is just better. First and foremost, please allow me to register my gratitude for your kind invitation to be here today, and I must say how honored I am to be your chief guest at this combined conference. I'd like to personally thank the organizers, the TICI medical units of Australia and Fiji, along with the management of the Sangam organization and TICI School of Nursing, for the insight to organize such conference, which will benefit nursing and medical students and the local medical practitioners. The TICI organization have indeed made significant contributions to the health of our Fijian people by providing free medical camps in various communities in Fiji in the last 10 years. These groups of volunteers, which include physicians, dentists, pharmacists, eye and other specialists, must be highly commended for their commitment and dedication to providing quality health care to our people, particularly those in the rural and remote areas, like in Labasa. I'm aware that the group had also brought in 2 surgeons, an anesthetist, and an operating theatre nurse on this trip to operate from Labasa Hospital. Along with this, I'm informed that the organization is also donating an operating table that is worth $20,000 to the hospital. I must say at this juncture that the Ministry of Health and Medical Services is sincerely appreciative of such gesture of love and care for the people of Labasa. Thank you. This is testament of good, strong and healthy public and public-private partnership. Medical camps of such nature and quality are always welcomed by our communities, particularly in our rural areas where accessibility to health services is sometimes, if not often, a challenge. The enriching combination of primary, secondary and specialist health services provided at these medical camps have yielded good health outcomes to many in our local populace in the past and undoubtedly will be the same for this year. The dual purpose of this year's program, which include the medical camps and the conference, is a well thought of initiative. The organization's focus on improving public awareness and also enhancing knowledge and skills for our health practitioners via this conference is certainly good mileage and will of course benefit our people. I note with great respect and interest the richness of your conference program, with the engagement of eminent physicians from Australia and New Zealand as presenters. I believe this sure adds great value and prestige to the conference. The Ministry of Health and Medical Services, in its bid to achieve its vision for a healthy population, continues to encourage all means of professional development for its human resource and this kind of conference will undoubtedly assist the ministry in enhancing the quality of services through a well-trained and qualified workforce. And I would like to congratulate our young family members, the nursing and medical students who have taken advantage of this opportunity by registering themselves to be participants. I'm positive that it will be time well spent and will enhance your knowledge. I believe that the inclusion of this conference in this year's program is indeed a bonus. As mentioned earlier, one of the strategic objectives of the Ministry of Health and Medical Services is to ensure that we have a well-trained and appropriately qualified health workforce in order to enhance the quality of service we deliver and also to be able to adequately address and respond to the evolving health needs of Fiji population. Therefore, the Ministry continues to support continuing education and professional development via various mode and delivery models for our staff. Medical conferences as such is one of the best way to upgrade staff knowledge and skills, and I hope that there will be sessions that also looks into the soft skills. I trust that this conference is accredited to some continuing professional development points, CDP points, which has now become a requirement for annual practicing license renewals for our health cadres, particularly the doctors and nurses. Having CPD points at conferences can attract the participation of more health professionals. On the other hand, with Fiji's non-communicable disease, NCD crisis, and our radical approach toward wellness, our need to have more people screened and followed up on the 3 cardinal diseases of diabetes, hypertension, and heart diseases has been a priority, and the Ministry welcomes all forms of support as that of these SAI-led medical camps. Your recognized capacity and profound ability in conducting screening programs and prescribing follow-up regimes at these medical camps is sincerely applauded. Women and men's health continue to be our ministerial agenda. Hence, conducting pap smear screening and consultation with men for prostate cancer will help our early detection and early treatment initiative. Sharing your in-depth knowledge, recent research findings, and skilled approach on this aspect at this conference will be helpful in our control strategy. Learning various approaches, establishing partnerships, and sharing resources to sustain quality child and adolescent health in Fiji can be a significant consideration and should also be explored formally by your organization and the Ministry of Health and Medical Services. In conclusion, I wish to once again thank the SAI organization on behalf of the Honorable Minister for Health and Medical Services, all the health staff and people of Fiji for your enormous contribution towards enhancing good health for our people, particularly our rural dwellers. I would also like to encourage the organization to continue helping Fiji by keeping a close view on Fiji's health landscape, and we will welcome your future partnership to assist us in achieving our health goals and objectives. With those few words, I am delighted to declare this conference officially open, and I sincerely wish you all the best. May God bless you all. May God bless Fiji. Thank you, Vinagara.
And I'd like to call upon the ladies who are that every Fijian lives and enjoys a quality and healthy life.
Mental health in Fiji has only slowly started coming up as a primary care health system. It has been in the past very much centralized in the hospitals. So it is very important that we continue at a very ground level to have enough training for our clinicians, whether they are nurses or allied staff, to be able to pick up on monitoring symptoms of a psychological nature.
The incidence of cervical cancer in Fiji. And we need good follow-ups. Out of the women that even come in for cervical cancer screening in Fiji, 70% are out there. We don't know what happens to them. Okay? And out of even those 30% that come in for follow-up, 72 women have the lifetime risk of developing ovarian cancer in their lifetime. Okay? 30 of them are advanced when they are diagnosed. Okay? And so if you look at only there's been a slight improvement in terms of mortality. And you look at the previous slides, we see